As a veterinarian who has worked with Shih Tzus for many years, I can say with absolute confidence that overfeeding is one of the most common and most dangerous mistakes owners make with this breed. Not because they are careless, but because Shih Tzus are exceptionally skilled at using their expressive eyes and gentle temperament to convince humans they need more food than they actually do. Unfortunately, from a medical standpoint, excess calories are one of the fastest ways to shorten a Shih Tzu's lifespan. Shih Tzus have a naturally high body fat percentage and a small skeletal frame, which means their bodies store extra calories very quickly. Once they gain weight beyond the healthy range, the additional mass places significant strain on their joints, especially the knees and hips. This is why overweight Shih Tzus frequently develop luxating patella, a condition where the kneecap slips out of place and early-onset arthritis. These issues are not only painful but can reduce mobility for the rest of the dog's life. The respiratory system is another major concern. As a brachycephalic breed dogs with short skulls and narrow airways, Shih Tzus already face structural breathing limitations. When they gain extra weight, fat deposits around the chest and neck further restrict their airway. This increases the risk of loud snoring, exercise intolerance, collapsed trachea, and even sleep apnea. The heart must also work harder to oxygenate their body, raising the likelihood of long-term cardiac disease. From a nutritional perspective, every Shih Tzu requires a calorie intake based on its ideal weight, not its current weight. This detail is often misunderstood by owners. Puppies need a slightly higher caloric density to support growth, while adult Shih Tzus need fewer calories as their metabolism slows. Maintaining a precise feeding schedule not only prevents obesity but also stabilizes digestion, reduces bloating, and helps regulate blood sugar levels. Treats are another significant factor. Many owners underestimate the caloric impact of treats because they appear small to the human eye. However, a single high-fat treat can equate to an entire meal for a dog weighing only a few kilograms. This is why treats should represent only a very small portion of the daily diet. Over time, the accumulation of extra treats contributes more to obesity than the main meals themselves. From an expert's perspective, the most dependable way to protect a Shih Tzu from overfeeding is through measured portions, appropriate food formulas based on age and health, and ignoring begging behavior no matter how convincing their expressions may be. Dogs cannot regulate their own nutritional balance, but you can, and in a breed as sensitive to weight gain as the Shih Tzu, proper dietary control directly translates into a longer, healthier life. Ultimately, feeding a Shih Tzu correctly is not about denying them pleasure, it is about preserving their well-being. A controlled diet is one of the simplest and most powerful medical interventions an owner can offer. It is a daily act of care that influences every year of your dog's future. Among all preventable health problems in Shih Tzus, dental disease is one of the most overlooked and yet one of the most damaging. As a veterinarian, I can confidently say that dental neglect is not a minor issue. It is a chronic medical problem that can shorten a Shih Tzu's lifespan significantly if not addressed early. Because of their unique skull structure and compact jawline, Shih Tzus are genetically predisposed to dental complications more than many other breeds. The first factor owners must understand is dental crowding. Shih Tzus have small as rounded mouths, but they possess the full set of adult teeth, just like larger dogs. This mismatch between skull size and tooth count creates overlapping teeth, trapped food particles, and poor natural cleaning ability. When plaque accumulates and hardens into tartar, bacteria begin to thrive at the gum line, leading to gingivitis, periodontitis, and ultimately tooth loss if untreated. Unfortunately, dental disease in Shih Tzus rarely stays confined to the mouth. Once oral bacteria breach the bloodstream, usually through inflamed gums, they can travel to vital organs. Veterinary medicine has long documented the link between chronic dental infections and heart valve disease, kidney dysfunction, and live. Small breeds like Shih Tzus are particularly vulnerable to bacterial endocarditis, a condition where bacteria attach to heart valves and compromise cardiac function. This is one of the reasons why maintaining oral hygiene is not cosmetic, it is life-preserving. Another critical issue is pain, which Shih Tzus are remarkably good at hiding. Many owners fail to recognize early symptoms because dogs adapt to discomfort until the disease becomes severe. Signs such as reduced interest in chewing toys, chewing on only one side, drooling, pawing at the mouth, or bad breath are often dismissed as normal dog behavior, when in fact they indicate infection or dental decay. By the time a Shih Tzu refuses food or cries when eating, the disease is already advanced. From a veterinary standpoint, the gold standard for preventing dental disease in Shih Tzus includes 3 essential components: daily brushing, routine professional cleanings, and appropriate dental diets or chews. Daily brushing is genuinely non-negotiable for this breed. Human toothpaste must never be used. Instead, enzymatic canine toothpaste should be applied with a soft bristled brush to break down plaque before it mineralizes into tartar. For many adult Shih Tzus, brushing every other day is sufficient. But for those already prone to buildup, brushing once daily is ideal. Professional dental cleanings under anesthesia are another key part of long-term oral health. Shih Tzus generally require cleanings every 6 to 12 months, depending on genetics and home care. This allows veterinarians to scale tartar beneath the gum line, something no home product can achieve, and address early periodontal pockets before they cause irreversible bone loss. Lastly, owners should understand that dental health directly impacts longevity. A Shih Tzu with consistently healthy teeth is more likely to maintain a strong appetite, stable weight, and a lower level of systemic inflammation as they age. In summary, dental neglect is not merely an aesthetic concern. For a Shih Tzu, it is a serious medical issue that affects comfort, organ health, and overall lifespan. Consistent oral care is simply one of the most effective long-term health strategies a Shih Tzu owner can commit to. One of the most significant decisions in a Shih Tzu's early life is the timing of spaying or neutering. As a veterinarian, I frequently see the long-term consequences of performing these procedures either too early, too late, or not at all. While every dog is unique, research and clinical experience provide clear guidelines that are especially important for a small, sensitive breed like the Shih Tzu. For most Shih Tzus, the ideal window for spaying or neutering is between 6 and 9 months of age. This timing balances 2 key factors: the dog's physical development and the prevention of hormone-driven diseases. When the procedure is delayed too long, the risks associated with reproductive hormones increase dramatically. When it's performed too early, the skeletal and endocrine systems may not have adequate time to mature. One of the primary medical concerns for unspayed female Shih Tzus is pyometra, a potentially fatal uterine infection. This condition typically develops after repeated heat cycles and requires emergency surgery in many cases. Spaying a female Shih Tzu before her first or second heat virtually eliminates the risk of pyometra. Furthermore, early spaying significantly reduces the likelihood of mammary tumors, which are hormonally driven. In small breed dogs, approximately half of all mammary tumors are malignant. Preventing these tumors through timely spaying is one of the most effective cancer prevention strategies available. For male Shih Tzus, neutering reduces the risk of benign prostatic hyperplasia, testicular cancer, and hormonally influenced behaviors such as marking, roaming, and aggression. While behavioral issues are often manageable, prostate enlargement in older intact males can lead to constipation, urinary obstruction, and painful infections, all of which can be avoided with early neutering. However, timing is crucial. Neutering a Shih Tzu too early, before 6 months, can interfere with the normal closure of growth plates in the bones. This may contribute to long-term orthopedic issues, including patellar luxation, a condition to which Shih Tzus are already genetically predisposed. Additionally, early removal of sex hormones can sometimes alter metabolic rates, increasing the risk of weight gain if diet is not carefully managed. On the other hand, delaying spaying beyond 12 to 18 months increases the likelihood of hormone-driven cancers and reproductive infections. Many owners choose to postpone the procedure due to misconceptions about temperament, growth, or letting the dog have a heat first. But these beliefs are not supported by veterinary science. In fact, allowing a Shih Tzu to undergo multiple heat cycles offers no medical benefit, and introduces risks that are entirely preventable. Pre-surgical blood work, proper anesthesia protocols, and careful post-operative monitoring are all essential steps, especially for brachycephalic breeds like the Shih Tzu, who require specialized airway management during anesthesia. When performed at the proper age under appropriate veterinary supervision, spaying or neutering is a safe and highly beneficial procedure. In summary, proper timing of spaying or neutering is a cornerstone of preventive medicine in Shih Tzus. It dramatically lowers the risk of life-threatening diseases, reduces behavioral stress, and contributes to a longer, healthier lifespan. Responsible timing is not simply a routine choice. It is a critical medical decision that shapes the health trajectory of a Shih Tzu for many years to come. Among all aspects of preventive care, regular veterinary checkups are the foundation of long-term health management in Shih Tzus. Yet many owners unintentionally underestimate their importance, often assuming that a dog who seems fine is healthy. From a veterinary perspective, this assumption can be dangerous. Shih Tzus are particularly prone to conditions that progress silently, making routine examinations essential rather than optional. Shih Tzus have specific anatomical and genetic vulnerabilities, and many of their health issues develop gradually without showing visible symptoms in the early stages. For this reason, the recommended frequency for veterinary checkups is once every 12 months for healthy adults, and every 6 months for seniors or dogs with chronic conditions. These intervals are not arbitrary. They are based on the typical progression rate of common diseases in small breeds. One of the most significant benefits of routine checkups is early detection. Conditions such as heart murmurs, kidney insufficiency, cataracts, and early periodontal disease can be identified long before they cause pain or irreversible damage. For example, Shih Tzus are predisposed to mitral valve disease, a progressive heart condition that may remain asymptomatic for months or even years. Detecting it early through routine exams and auscultation allows for timely intervention, which can significantly extend the dog's lifespan. Routine checkups also provide opportunities for baseline diagnostics, including blood tests, urine analysis, and fecal examinations. These tests offer critical insight into organ function, electrolyte balance, and internal infections that cannot be identified through outward observation alone. In Shih Tzus, early kidney disease, liver enzyme abnormalities, and thyroid imbalances often appear in laboratory results before clinical signs become visible. Medical intervention at this stage is far more effective than waiting until symptoms emerge. Another essential aspect of regular veterinary visits is monitoring brachycephalic respiratory health. Shih Tzus frequently develop issues such as elongated soft palate, stenotic nares, and tracheal collapse. These conditions may appear mild at first, snoring, snorting, or occasional coughing, but can escalate quickly under heat stress, weight gain, or age-related tissue changes. Routine evaluations allow veterinarians to determine when corrective procedures or management strategies are necessary to prevent breathing emergencies. Vaccination updates and parasite prevention are additional components of routine care that many owners unintentionally fall behind on. Even indoor Shih Tzus require consistent protection against heartworms, fleas, ticks, and intestinal parasites, which can be transmitted through mosquitoes, contaminated soil, or other animals. A lapse in preventive medications increases the risk of avoidable illnesses that can escalate into serious or life-threatening conditions. Finally, routine checkups create an ongoing wellness history for each individual dog. This cumulative record is invaluable for identifying subtle trends: slow weight gain, gradual vision decline, changes in appetite, shifts in behavior that may indicate emerging health problems. Early intervention always results in better outcomes, reduced treatment costs, and improved comfort for the dog. In summary, inadequate veterinary checkups pose significant risks for Shih Tzus due to their predisposition to silent, progressive conditions. Regular examinations allow for early detection, preventive care, and proactive management, all of which contribute directly to a longer, healthier life. For a breed as delicate and complex as the Shih Tzu, routine veterinary supervision is not simply recommended, it is medically essential. A common misconception among Shih Tzu owners is that the breed is naturally lazy or requires minimal physical activity. While Shih Tzus do enjoy resting and are more sedentary than high-energy breeds, they still require consistent daily exercise to maintain proper cardiovascular health, muscle tone, metabolic stability, and behavioral balance. As a veterinarian, I routinely see the long-term impact of inadequate exercise in this breed, and the consequences extend far beyond simple weight gain. First, owners must understand that Shih Tzus are companion dogs, not ornamental animals. They may be small, but their bodies are designed for movement. Without regular activity, their metabolism slows, their joints stiffen, and their respiratory system becomes less efficient. This is particularly problematic for a brachycephalic breed with a naturally restricted airway. Regular, moderate exercise helps improve oxygen exchange, strengthens respiratory muscles, and reduces the severity of snoring and breathing difficulties. Insufficient exercise is one of the primary contributors to obesity, which in turn exacerbates numerous existing breed-specific vulnerabilities. A sedentary Shih Tzu is far more likely to develop insulin resistance, chronic inflammation, and decreased muscle strength, making them more susceptible to orthopedic issues such as patellar luxation. Additionally, a lack of physical activity accelerates sarcopenia, the age-related loss of muscle mass leading to frailty in senior years. From a cardiovascular standpoint, daily exercise is crucial. Shih Tzus are predisposed to mitral valve disease, a degenerative condition of the heart. Regular mild to moderate physical activity supports cardiac function, improves circulation, and slows disease progression. Conversely, inactivity can lead to decreased cardiac resilience, making the dog more vulnerable to heart failure as it ages. Behaviorally, insufficient exercise often manifests as anxiety, excessive licking, attention-seeking behavior, barking, or destructive tendencies. Many owners misinterpret these signs as personality issues, when in fact they are clinical indicators of understimulation. Even 10 to 15 minutes of structured movement can significantly reduce stress hormones and improve emotional stability. Shih Tzus that receive daily exercise exhibit better sleep patterns, more balanced temperament, and greater overall compliance with training. In practical terms, Shih Tzu puppies require approximately 30 to 40 minutes of total exercise per day, divided into multiple short sessions. Adult Shih Tzus generally benefit from 45 to 70 minutes daily, ideally broken into 2 or 3 shorter walks to avoid overheating and respiratory strain. High-intensity exercise is not necessary, nor recommended. Instead, slow to moderate walking, free roaming in a secure yard, and light play sessions are optimal for joint health and stamina. Environmental factors also matter. Because Shih Tzus are sensitive to heat due to their brachycephalic structure. Exercise should be scheduled during cooler hours, with access to shade and hydration. Indoor play, puzzle feeders, and low-impact training sessions can supplement outdoor activity on hot or humid days. Ultimately, exercise is not optional, for a Shih Tzu is a medical requirement. Regular movement supports nearly every system in the dog's body, from cardiac to digestive to psychological. When owners provide consistent, appropriate exercise, they dramatically extend both the length and the quality of their Shih Tzu's life. A physically active Shih Tzu is a healthier, happier, more resilient companion. While physical exercise is essential for a Shih Tzu's body, mental stimulation is equally critical for their cognitive, emotional, and behavioral stability. As a veterinarian with experience in canine behavior, I frequently see owners underestimate this component of care. Shih Tzus may appear calm and low energy, but they are highly intelligent, socially driven dogs who require varied forms of mental engagement to stay healthy. When this need is unmet, the consequences can be significant and far-reaching. The Shih Tzu's historical role as a companion breed means they evolved to spend large amounts of time observing human behavior and responding to subtle emotional cues. This makes them adept learners with strong memory retention. However, without opportunities to use these cognitive abilities, Shih Tzus can develop signs of boredom, frustration, and anxiety, which often manifest as behavioral issues. These may include excessive barking, pacing, destructive chewing, attention-seeking behaviors, and shadowing their owners excessively. From a neurological perspective, mental stimulation directly affects a dog's prefrontal cortex, the part of the brain associated with problem-solving, impulse control, and emotional regulation. When this area is underused, neural pathways weaken over time, increasing the risk of canine cognitive dysfunction, CCD, the canine equivalent of dementia, particularly in senior Shih Tzus. Consistent cognitive challenges strengthen these pathways and slow age-related decline, significantly improving long-term quality of life. Training is one of the most effective ways to engage a Shih Tzu mentally. Contrary to common misconceptions, even older dogs can and should learn new skills. Short, structured sessions lasting 10 to 15 minutes are ideal. Positive reinforcement techniques not only build cognitive resilience, but also enhance the human-dog bond, reinforcing trust and communication. Puzzle toys, slow feeders, scent tracking games, and interactive toys are also excellent tools for mental enrichment. These activities engage multiple senses simultaneously and encourage problem-solving behavior. For example, nosework games stimulate the olfactory centers in the brain, which are highly developed in all dogs. Using food-based puzzles allows Shih Tzus to engage instinctive foraging behaviors in a controlled, enriching environment. Social interaction is another critical component of mental stimulation. Because Shih Tzus form strong emotional attachments, regular, positive social exposure helps prevent anxiety and improves adaptability. This may include meeting new people, encountering new environments, or interacting with other calm dogs. Without this kind of exposure, a Shih Tzu may become increasingly fearful or reactive, particularly during adulthood and senior years. Environmental variety also plays a role. Repetitive routines without novelty can dull cognitive engagement. Simple changes such as rotating toys, altering walking routes, or introducing new indoor activities offer valuable stimulation. These adjustments do not require significant time but provide meaningful mental benefits. A lack of mental enrichment also influences physical health. Dogs experiencing chronic boredom or stress may exhibit elevated cortisol levels, suppressed immune function, and reduced appetite. Over time, psychological stress can contribute to gastrointestinal issues, skin problems, and sleep disturbances. In summary, insufficient mental stimulation is a frequently overlooked but clinically important issue in Shih Tzus. Providing daily cognitive challenges improves behavior, reduces anxiety, strengthens neurological health, and supports emotional well-being. For a breed as intelligent and emotionally perceptive as the Shih Tzu, mental stimulation is not a luxury, it is a medical necessity. Among all behavioral concerns seen in Shih Tzus, separation-related stress is one of the most prevalent and one of the most misunderstood. As a veterinarian with a background in canine behavior science, I can confirm that Shih Tzus are genetically and behaviorally predisposed to forming deep emotional bonds with their caregivers. This makes them uniquely vulnerable to the effects of prolonged isolation. Leaving a Shih Tzu alone for extended periods is not a benign inconvenience, it is a direct risk factor for both psychological and physiological decline. Shih Tzus were developed specifically as companion animals, bred to live in close proximity to humans. Because of this history, their attachment system is highly sensitive. They rely on social contact to regulate their stress responses. When left alone for too long, cortisol levels rise, triggering a cascade of physical and neurological effects. Chronic elevation of stress hormones can contribute to digestive disturbances, reduced immune function, sleep disruption, and increased susceptibility to infection. In puppies, the impact is even more pronounced. Puppies under 6 months lack the cognitive maturity to self-soothe during isolation. Leaving them alone for more than 1 hour at a time frequently leads to early-onset separation anxiety, which can persist into adulthood. These dogs often develop behaviors such as excessive vocalization, destructive chewing, indoor urination despite prior training, and hyperattachment when the owner returns. Early social deprivation also interferes with emotional development, making the dog more prone to fear-based behavior later in life. Adult Shih Tzus may tolerate isolation slightly better, but prolonged alone time still poses significant risks. Dogs that regularly experience extended separation often exhibit behavioral regression, heightened clinginess, compulsive behaviors such as licking, pacing, or repetitive whining, and in some cases, withdrawal or depressive states. Many owners misinterpret these behaviors as stubbornness or neediness, when in reality they are clinical indicators of emotional stress. From a physiological standpoint, separation-induced stress has a direct effect on cardiovascular health, increasing heart rate and blood pressure for extended periods. Over time, this adds strain to the heart, particularly concerning in a breed already predisposed to mitral valve disease. Stress can also upset gastrointestinal function, leading to vomiting, diarrhea, or reduced appetite. In terms of preventive care, the goal is not to eliminate alone time entirely, but to manage it responsibly. Structured independence training, gradual desensitization, and environmental enrichment can mitigate anxiety. This may include leaving interactive toys, providing food puzzles, or using calming aids such as pheromone diffusers. Establishing predictable routines also helps reduce anticipatory anxiety. For owners with demanding work schedules, practical solutions include dog sitters, doggy daycare, or scheduled breaks during the day. Rotating attention between family members can also distribute the dog's emotional reliance more evenly, reducing anxiety when one person leaves. Ultimately, Shih Tzus are not behaviorally suited for long periods of solitude. Their emotional health directly influences their physical health, and chronic loneliness can shorten lifespan through cumulative stress effects. Ensuring adequate companionship is not simply a kindness, it is a medical priority. For a breed defined by its capacity to bond, consistent social interaction is essential to both longevity and quality of life. One major but often overlooked factor that affects a Shih Tzu's long-term health is the management of its living environment. As a veterinarian, I frequently encounter preventable injuries and chronic conditions caused not by illness, but by unsafe household setups, inappropriate furniture arrangements, or everyday hazards owners never realized could harm a small dog. Environmental mismanagement is a silent contributor to reduced longevity. Aspecia. The first and most common environmental issue is jumping. Shih Tzus have short legs and a disproportionately long spine, making them biomechanically vulnerable to impact injuries. Jumping off beds, couches, and stairs puts them at high risk for ligament damage, spinal compression, and exacerbation of pre-existing conditions such as patellar luxation. Owners often underestimate how much force a small dog absorbs when landing from even modest heights. Over time, repetitive microtrauma leads to joint degeneration, chronic pain, and reduced mobility. Another frequent hazard is slippery flooring, such as tile, hardwood, or polished surfaces. Shih Tzus rely heavily on traction for joint stability. When repeatedly forced to walk or run on slippery floors, they experience undue strain on hips, knees, and ankle, critical points already prone to orthopedic issues. Dogs that slip often may develop muscle tension, soft tissue injuries, or fear-based movement avoidance. The use of rugs, non-slip runners, or paw grip sprays significantly reduces these risks. Temperature regulation is another major concern. Shih Tzus are brachycephalic and cannot cool themselves efficiently. Excessive heat, lack of ventilation, or exposure to humidity increases the likelihood of heat stroke, a life-threatening condition that can escalate within minutes. Conversely, because of their small size and thin abdominal fur, Shih Tzus are also sensitive to cold environments. Drafty homes, air conditioner vents pointed directly at the dog, or tile floors in winter can trigger respiratory irritation, joint stiffness, and decreased immunity. Household toxins also pose a significant risk. Cleaning products, scented essential oils, rodent poisons, human food left at reachable heights, and certain houseplants can cause gastrointestinal, respiratory, or neurological damage. Shih Tzus, being close to the ground, inhale and ingest more environmental particles than taller breeds. They are especially sensitive to volatile chemicals and artificial fragrances. Ensuring proper storage, ventilation, and safe substitutes is a critical part of preventive care. Another overlooked factor is overstimulation from noise and activity. Shih Tzus are emotionally sensitive animals. Chronic exposure to loud environments such as construction noise, constant visitors, or high-conflict households can elevate cortisol levels and create long-term anxiety. This sustained stress weakens the immune system, disrupts sleep, and increases the risk of stress-induced conditions. Finally, inadequate hygiene of living spaces, dirty bowls, infrequent bedding changes. Poorly maintained grooming areas can expose Shih Tzus to bacterial or fungal infections. This is especially problematic for dogs with skin folds, tear staining, or allergies. In summary, environmental mismanagement is an underappreciated but impactful factor in Shih Tzu health. Preventive environmental design safe surfaces, temperature control, toxin avoidance, noise moderation, and safe elevation practices is essential to protecting this delicate breed. A well-managed environment is not simply comfortable, it is medically necessary for a Shih Tzu's longevity and overall well-being.